Good morning to all. Today we are going to discuss about antifungal agents. So, coming to an introduction, these are the agents which are used for superficial and deep fungal infections such as mycosis. Then, antifungal agents that can be classified according to their mechanism of action. So, the first one is the agents which inhibit cell wall synthesis and the agents which increases the cell membrane permeability and causes the leakage of contents out of the cell. Next one is the agents which inhibit fungal ergosterol synthesis. Next one is the agents which inhibit nucleic acid synthesis. Okay, so the first one is fungal cell wall synthesis inhibitor. Examples are echinocandins such as capsofungin. Then increasing cell membrane permeability. Example Pauline group of antibiotics such as amphotericin B and nystatin. Next one is lanosterol and ergosterol synthesis inhibitors such as terbinafine. And next one is ergosterol synthesis inhibitors, which include imidazole group of drugs such as clotrimazole, ketoconazole, and triazole such as fluconazole and itraconazole. Next one is the agents which inhibit protein synthesis. Example is 5-flucytosine. Next one, the agents which inhibit fungal mitosis. Example griseofulvin. Next one is others include benzoic acid and salicylic acid. So coming to first class, that is antifungal antibiotics, there is amphotericin B, which is a Pauline antibiotic. In addition to amphotericin B, there is nystatin and hamycin. Next one is griseofulvin, and next one is echinocandins such as capsofungin and micafungin. Okay, coming to amphotericin B in detail, which is a drug obtained from Streptomyces nodosus. The mechanism of action of amphotericin B is which inhibit the fungal cell membrane synthesis. They binds to ergosterol on fungal cell membrane and increases the cell membrane permeability by forming certain aqua pores. And the contents of cell will leak out of this channel and causes cell death. Then, amphotericin B is a broad spectrum antifungal agent used against various fungi such as Aspergillus, Blastomycosis, Candida albicans, Histoplasma, Leishmaniasis or Cala-Azar type protozoal infections. Coming to the kinetics of amphotericin, which is not absorbed orally, which is given intravenously, intrathecally or topically. But it can be given orally in case of intestinal candidiasis. And it has poor CSF penetration. Then liposomal amphotericin B is a lipid complex which has certain advantages compared to conventional preparations such as lower nephrotoxicity and less acute reactions on intravenous administration. Coming to the adverse drug reactions of amphotericin, which is a most toxic antifungal agent and cause acute reactions such as fever, chills, vomiting, hypotension, etc. Then nephrotoxicity is considered as the most common and serious ADR of amphotericin B, and it can also cause anemia. Next one is the uses of amphotericin B, which is used in serious systemic mycosis like mucormycosis, invasive aspergillosis, progressive histoplasmosis, and given intrathecally in cryptococcal meningitis, and also topically used in oropharyngeal, vaginal and cutaneous candidiasis. Next one is drug interactions. Concurrent administration of nephrotoxic drugs like aminoglycoside should be avoided with amphotericin B. Next one is oral antibiotics such as griseofulvin obtained from Penicillium griseofulvum, which is a fungistatic agent which is used orally. So coming to the mechanism of action of griseofulvin, which inhibit the microtubules in the nucleus and disrupt the mitotic spindle formation and inhibit the fungal mitosis process. Other mitotic spindle inhibitors include vinca alkaloids and colchicine. Then coming to the spectrum of activity of griseofulvi, which is effective against dermatophytic infections, which is caused by trichophyton, microsporum, epidermophyton. Okay. Then the griseofulvin, which is concentrated in keratin forming cells of skin, hair, nail, etc., which persists for weeks in these areas and which is given orally, ineffective in topically. Coming to the ADR of griseofulvin, which causes headache as most common ADR, then GIT, upset and photosensitivity reactions. The uses of griseofulvin include superficial dermatophytosis of scalp, palm, toes, etc. Then next one is azole group of antifungal agents, which include imidazoles such as ketoconazole, miconazole, iconazole and clotrimazole. This miconazole, iconazole and clotrimazole are given orally, whereas KZ or ketoconazole is using both systemically and topically. Then triazole, which include fluconazole, itraconazole and voriconazole. Their mechanism of action is to inhibit the lanosterol 14 alpha demethylase enzyme in fungal cell wall and reduces the ergosterol synthesis in fungal cell membrane and causes destabilization of fungal cell membrane. They are fungistatic in nature. Okay. Here we can see the mechanism of action of azole antifungal drugs, which inhibit the conversion of lanosterol to ergosterol by inhibiting the enzyme 14 alpha demethylase enzyme. Okay. Then they are effective against blastomyces, Candida species, Cryptococcus, coccidioids, histoplasma, ringworm infections, etc. Ketoconazole is considered as the first azole to be used orally both in superficial and deep mycosis. Then coming to the ADR of ketoconazole, there is nausea, vomiting, endocrine abnormalities, which is very important, such as gynecomastia, oligozoospermia, impotence in male, menstrual disturbances. Then uses of ketoconazole, which is used orally in case of dermatophytosis, as it is concentrated in stratum corneum. Then it is used topically in dandruff preparations, cutaneous and oral candidiasis. Since it is toxic for systemic use, it is replaced by triazole like fluconazole. Then coming to the drug interactions of ketoconazole, it is an enzyme inhibitor. So it will inhibit the metabolism of co-administered drugs, hence which results in toxicity of the co-administered drug. Examples: ketoconazole with warfarin. The warfarin metabolism is inhibited by ketoconazole and which causes increased warfarin level in blood, results in bleeding. Next one is fluconazole, is a triazole which is available in oral, IV or topical preparations. So its spectrum is already explained. Okay, coming to the pharmacokinetics of fluconazole, which is absorbed orally, which reaches high concentration in cerebrospinal fluid. The ADR of fluconazole include nausea, vomiting, headache, skin rashes, and not safe in pregnancy. Fluconazole is used in oral, esophageal, vaginal, cutaneous candidiasis, oral candidiasis management with topical nystatin or clotrimazole, oral by giving tab fluconazole 100 mg per day for 2 weeks. Then for cryptococcal meningitis it can be used. It has good CSF penetration. And it is also a drug of choice for dermatophytosis infections, blastomycosis, histoplasmosis, etc. But is not effective in aspergillosis and mucormycosis. Coming to the advantages of fluconazole over ketoconazole, the fluconazole has a wide spectrum of activity, better CNS penetration and less pharmacokinetic interactions. Okay, and no endocrinal abnormalities like KZ. Next one is terbinafine, which inhibits squalene epoxide reductase enzyme, thereby inhibit ergosterol synthesis, which is used mainly in dermatophytic infection, Candida infections. Main ADR include GIT disturbances and headache, used in superficial fungal infections and topically in tinea pedis and tinea corporis infection, used orally in onychomycosis. Next one is flow cytosin, which inhibit the nucleic acid synthesis, have narrow spectrum of activity, so it is used in combination with amphotericin B. Due to easy entry of flow cytosin into the fungal cell is facilitated by amphotericin B, and it reduces the duration of therapy also. And toxicity of amphotericin B can be reduced if it is combined with flow cytosin. And the ADR include bone marrow suppression used in cryptococcal meningitis. Next one is topical antifungal agents, which include nystatin, clotrimazole, miconazole and terbinafine. They are mainly used in tinea, onychomycosis, cutaneous vulvovaginitis and oral or visceral candidiasis. Okay, here is the university questions from antifungal drugs. The first is a question, that is the classification of antifungal agents with suitable examples, and a note on an ADR of any specific drug. Okay, here we can see the short notes regarding this portion. Amphotericin B is a short note, griseophylline, ketoconazole, etc. Okay, so thank you.